Hello, this is Doc Talks. I'm Dr. Don Selvia, naturopathic physician at Copper Valley Medical in Chandler, Arizona, and this is an introduction to hepatitis. We've had a couple of questions in the practice recently about this disease, and we just wanted to go over some of the issues so that it's a little bit clearer to patients as they start looking at hepatitis, ways to diagnose, ways to treat. So, hepatitis, in the broadest sense of the term, is an inflammatory process of liver cells or hepatocytes. Usually, if we have a word ending in itis, itis, it simply refers to an inflammatory response to that type of a cell. So that hepatitis is an inflammation of the hepatocyte, so it's hepatitis. Inflammation is a result of tissue injury, and very often that includes infection. And so while there are a number of conditions and a number of circumstances that may cause injury to liver cells, when we talk about hepatitis medically, it is almost synonymous with a viral infection of the liver. There are 5 broad types of viral hepatitis, and we're going to walk through these one at a time, but here's the big overview: Hep A, B, C, D, and E. So a word about viral versus bacterial infections as we get started here. Bacteria are microorganisms that have a nucleus. It's not membrane bound, but they do have a nucleus. They have certain other cell organelles. Typically there's a piece of genetic material. It's almost always going to be DNA, sometimes called a plasmid. It's a little circular piece. Now, our DNA is a double-stranded molecule. In a bacteria, it's not. It's a little circular piece of DNA. The big part is that bacteria are considered to be living cells. They procreate, they reproduce, and as such, they can be killed with an antibiotic. Think of penicillin that was used, 100 years ago. All right, viruses may be thought of as little strands of RNA or DNA, not both, usually going to be wrapped in a little bit of a protein membrane. And while the virus can replicate, it does not procreate. Therefore, it's not technically alive, and we do not kill viruses with an antibiotic. There are a number of antiviral agents that are developed specifically for unique viruses, and more continue to be discovered. But we have different types of ways to treat viruses than bacteria. By the way, quite a number of botanical agents are also antiviral and have a nice effect there. So let's talk about viral hepatitis. We're going to talk about the big 3, hepatitis A, hepatitis B, hepatitis C, and identify that while they have some things in common, they are very distinctly different from each other. Hepatitis A is caused by the hepatitis A virus, also known as a hepatovirus. It is a single strand of RNA enclosed in a protein coat, and this is in a class of viruses known as picornaviruses. Pico, P-I-C-O, is the prefix meaning small, RNA virus. So that's how it got its name, a picornavirus. All right, hepatitis B is caused by a virus that's different. It's the hepatitis B virus. Now, this one is a double-stranded DNA virus that is enclosed in a protein surrounded by a lipid coat. It is a much more complex structure than the hepatitis A virus. So hepatitis A, single-strand RNA. Hepatitis B is a double-strand DNA. Hepatitis C, which we're getting a lot of information about over the last few years, is a single-strand RNA enclosed in a protein coat, and that is going to be surrounded by a lipid coat with 2 special proteins called glycoproteins in this outer coat. It's a different structure than A or B. While you might seem to think that this is going to be similar to hepatitis A, in fact, it is not. It is much more like hepatitis B. More on that in just a minute. So each form of the viral hepatitis organism is not only unique and different from each other, but the viruses are transmitted differently from one person to another. And because of that, different groups of people are more or less at risk of contracting the disease. So while we have some unique features here with these viruses, there is a similarity. Almost all of these are likely to turn the skin and the eyes, the whites of the eyes, yellow, jaundice or icterus in case of the eyes. These different forms of hepatitis, because of their uniqueness in transmission, have unique treatment regimens and then unique prevention regimens. So we talked about the jaundice or icterus, the yellowing of the whites of the eyes. Other common symptoms of hepatitis, and again, that doesn't mean everybody's going to have it, but the common symptoms are going to be this malaise, this general fatigue, nausea, can lead to a loss of appetite. It is not uncommon for there to be vomiting and diarrhea. Some persons will, because of this, experience weight loss. Patients may experience fever, headache, muscle and joint aches. Not everyone's going to get all of these things, but these are the things that we normally expect to see in a patient with hepatitis. All right, let's start with hepatitis A. This is the form of hepatitis that used to be called infectious hepatitis. It is a foodborne, waterborne disease, which means in order to become infected, a person must ingest the virus by mouth, either by food or by water. Here's the bad thing. This virus is excreted in feces, so the sources of infection have to include water or food that is contaminated with the feces of someone shedding the virus. This is called a fecal-oral route of transmission. So here's our scenario. When you develop hepatitis A, I want you to think of some very kind, generous server at your favorite restaurant who is shedding the hepatitis A virus. They go to the restroom, they have their bowel movement, and they see very clearly that sign that says, you've all seen them, employees must wash their hands before returning to work. They choose to ignore that, or they do a little splatter of water, and then they have this virus on their hands, and they add it to your food, yuck, 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 and you now have hepatitis A. Here's the good news. It's usually self-limiting. There is a vaccine available now. This virus is not going to cause chronic liver disease, chronic hepatitis. It's just yucky. It's been said that if we could get every man, woman, and child on planet Earth to wash their hands with hot soapy water for 20 seconds after a bowel movement, that this virus would cease to exist. Well, it's interesting to me in this age of the COVID virus and everybody appearing to take a lot of responsibility for hand washing, that maybe, just maybe, we'll have a significant decrease in the incidence of hepatitis A. It's going to be interesting to follow the epidemiology of that one. Hepatitis B is a more complicated version of the hepatitis. There are at least 5 possible variations of this. So the first one is that a person becomes acutely ill followed by a complete recovery. That's ideal. If you have to have it at all, this is good. The second one is that it develops into a chronic hepatitis, but it does not seem to progress. Third possibility is that it will develop chronic hepatitis, and that's going to cause severe liver damage that we call cirrhosis. Cirrhosis we normally think of as someone that has a lifetime of alcohol abuse. Well, with chronic hepatitis, they may have that same type of cirrhosis. This means that the liver is not going to function. The liver is a main producer of proteins in the body for things like circulating hormones and doing the immune system and all these other really important functions. And somebody with chronic hepatitis is not going to have that ability. So they are going to be compromised and they're going to be a sick person. Okay, the fourth type is what's called fulminant hepatitis. Now, fulminant means that it's a sudden acute disease and it just goes immediately into the chronic state. It's severe liver damage. This would actually cause necrosis, that is death of the hepatocytes. So obviously this is not just that it's not functioning well like cirrhosis, it's not functioning at all. So if fulminant hepatitis comes from hepatitis B, this is something that you definitely want to avoid. The fifth possibility is what's known as an asymptomatic, that is, the patient has no symptoms of illness, but they are shedding the virus in their feces. Sorry, I said that incorrectly. They are shedding the virus into their blood, and anytime that there is a blood exposure, they could be passing this on to someone else. So hepatitis B is then a bloodborne disease. It's not a fecal oral like hepatitis A, and it is passed with exposure to infected blood. So if there are blood transfusions, by the way, now we monitor donated blood pretty carefully, and that's not likely to happen in this country. If someone has a really, how do we put this nicely, a rough, violent intercourse that turns bloody, use your imaginations. Hepatitis B can be transmitted with that one. The bigger issue would be healthcare workers that are exposed to blood and body fluids, whether it is spittle, vomitus, urine, open weeping wounds. Anytime that their patient has that, there's a risk of hepatitis B being transmitted. So healthcare workers are all trained very carefully in bloodborne pathogen exposure risks and how to prevent that. I wish that everyone was. Hepatitis C is the one that was once called non-A, non-B hepatitis. It is transmitted through the blood, especially through intravenous drug use. This one is, hepatitis C is much more likely than hepatitis B to progress to a chronic disease condition, which over time will lead to liver damage and failure. It is one of the leading causes of liver failure in the world. The big deal is that about 75% of the people with hepatitis C show no symptoms, and so unless there is a reason to screen for it or do a test, patient will never understand that they have hepatitis C, and yet it will kill them in time. As long as we're here, let's talk about the other two forms as well. Hepatitis D, or delta hepatitis, is a defective version of hepatitis B. It's not hepatitis B, but it's very similar to it. It occurs only when a patient already has hepatitis B, so it's a co-infection. Almost always patients will clear this, recover completely, and probably never know they have. Hepatitis E is not very common. We find it in India and some third world countries and other continents, not so much here in North America. It is a fecal oral transmission. It's not associated with chronic liver disease, so we don't pay much attention to it. However, in third world countries and in India, it is associated with a very high, maybe 40%, 50% pregnancy mortality rate. So it's worth paying attention, particularly if you're going to go to other countries. All right, how do we deal with hepatitis? Hepatitis A is self-limiting, so usually only palliative care is required. Again, there is a vaccine now. Anyone with Hep A really needs to be aware of the risk of transmitting the virus to other people. And so wash your hands, wash your hands, wash your hands, wash your hands. Again, if we get everybody to wash their hands, this one goes away. We can eradicate this one without drugs, just washing your hands. Okay, hepatitis B. Again, the best treatment here is prevention. So we talked about healthcare workers that are trained in bloodborne pathogen prevention. Again, if we could get everybody to think of every body fluid as being a potential pathogen, it would probably help. That means when somebody sneezes or coughs, they could be shedding a virus. There is a multi-part vaccine that is given to healthcare workers and can be given to other people now. As I recall, it's a 2 or 3 part series, and it's pretty effective. I would strongly recommend people consider that, considering the damage that is done to them, to their liver, and loss of activity and even loss of life if they get the virus. I was vaccinated against hepatitis B many years ago, and I have no regrets about that at all. Okay, hepatitis C is the one that there is now a cure for this. The cure doesn't necessarily reverse the liver damage, but it does actually kill the virus. And so since 75% of people don't know that they have this, screening is probably a really good idea for it. Okay, the reason this comes up as a question even in our practice is that hepatitis C is a qualifying condition for medical marijuana in Arizona. I'm not sure about other states, but in Arizona it is a qualifying condition. And so this one is diagnosed by the presence of the antibodies, not by a presentation in the office. Okay, that's our quick overview of hepatitis, and we hope you enjoyed it. If you have any questions, feel free to give us a contact. I'm Dr. Don Selvey. I'm the Medical Director at Copper Valley Medical in Chandler, Arizona.